Hello, everybody. My name is Jennifer Requejo, and I am based at UNICEF headquarters in New York. I'm part of the Data and Analytics Division, and I am responsible for the Health and HIV teams. I'm going to be speaking to you today about construct number 5.2, for which I am suggesting that there's an existing indicator, but I am requesting some modification to the way in which it's being presented in the EPMM formulation. The proposed construct for measurement is an indicator that tracks coverage of death and birth registration, and the formulation, the latest formulation of it is death and birth registration coverage. I wanted to pause here and go back to give a little more history on how this construct came to be included in the EPMM Phase 2 framework. So the EPMM Key Themes document that you have all seen mentions MDSR 3 times under separate themes, and also in the publication that I think was circulated to you all as well as part of this consultation process, there's a table in there that lays out the Phase 2 selected indicators and how they map onto the Phase 1 indicators. So you can see that in Phase 1, we had maternal death registration selected, and in Phase 2, to complement that, there's the maternal death review coverage and civil registration coverage of cause of death with a percentage. So in terms of clarification of the construct for measurement, I think it's important to unpack this indicator because it currently includes two very distinct indicators on birth registration and death registration. Although both of these indicators are linked to the SDG 17.9 target that's linked with strengthening the CRVS system, capturing information on birth registration and death registration is done through different mechanisms, and each one of these indicators has a different social value and significance. For birth registration, it has its own SDG target, 16.9.1. For death registration coverage, even if we separate it out from birth registration coverage, I think we would want to unpack this further for the purposes of EPMM to be more focused on maternal death registration rather than all deaths. And then I feel that this unpacking is more consistent with the EPMM indicator framework and themes. Also, I was just pointing out that death registration, another reason why we want to consider it separately from birth registration, is that there are more complexities to it because of the need for cause of death information. Moving on to looking at birth registration, the definition of it in the target SDG 16.9.1 is the proportion of children under 5 years of age whose births have been registered with the civil authority. Here I'm listing some of the areas of significance for this indicator. It's a critical first step in recognition of a child's existence and establishment of their identity. This is something that will be essential for that child throughout her lifetime, and access to other human rights. In terms of the state of measurement in respect to birth registration, UNICEF is serving as the custodial agency for SDG 16.9.1, and there is now a process underway for regular assessments of 3 related indicators. The first ties in directly with the target: number of unregistered children under the age of 5, number of unregistered children under the age of 1, which is actually now being touted as the more useful metric, and number of children and infants without birth certificates. I think you've seen in other presentations the steps that are involved with birth registration and the eventual issuance of a birth certificate. So there are 3 steps. The first is having the midwife or someone declare the birth happened. Then there's the birth registration step by the civil registrar, and then after that is the issuance of the birth certificate. In terms of data sources, I've listed them all here on the slide. I won't go through them in too much detail because you can see this on the slide yourselves, but the ideal data source is the civil registration vital statistics system. There are lots of challenges with this system in terms of different countries have different issues, but insufficient legal frameworks is common. Sometimes People are faced with registration fees that they can't meet. Sometimes the registration process is overly complex, and there are challenges with data quality. In countries where CRVS systems are not sufficient for getting adequate birth registration data, there can be the use of household surveys and census, but these are not ideal sources. They tend to have bias in them, and certain population groups that are not captured often in surveys and census methods, like migrants and refugees, are then missed. There are a lot of improvements underway in terms of getting data for birth registration. There's a Health Data Collaborative module on this to help countries better report this information. And there are lots of things underway with innovative technologies. The Move It is one example, and E&M strategies and other digital tools. And there is effort to try and get birth registration linked to other services. So when a child is brought in for immunization, if that child's not been registered, perhaps that's an opportunity to do it at that time. And then there is now, as I was saying previously, regular assessments of progress, and I've just put down here a report that you could go and refer to if you are interested in more information about birth registration. In terms of measuring this construct, yes, I think it's valid. It's clear what's meant to be measured, and it makes logical sense and scientific sense. I've already stressed the challenges with collecting information through the CRVS system, and timeliness is also a challenge, and especially if countries are relying on survey or census data. For harmonization, I think that it's important that EPMM indicators align as much as possible with the SDG framework, and it's also, birth registration is also critical for monitoring basic human rights. It's not redundant with the EPMM framework, but I wonder if it would be better placed in the ENAP framework that is complementary to EPMM. In terms of relevance, this is just a kind of laying out. I've put in yellow highlight my thoughts on these particular issues. So I don't think that birth registration is directly relevant to reducing maternal mortality. However, the maternal mortality ratio uses live births as the denominator. So birth registration would be important to making this measurement better. So in that regard, it is relevant to maternal health. And that is kind of what I'm repeating, that it's not significantly associated with improved maternal health and survival, aside from it being an important part of the denominator for MMR. I think in terms of interpretability and usefulness, again, there's clear evidence that birth registration is really essential for improving life prospects for all children, but it's not the real strong evidence about the link with improving maternal health outcomes, unless we're making a stretch and thinking about comparing girl children who are registered versus girl children are not, and whether that has any bearing on how well they do through pregnancy. And then again, monitoring MMR is a key indicator for assessing progress on maternal health. So there is that link. And then it's just sort of, again, this just reiterating this theme about the direct relevance I don't see as being there, but I do think the indirect benefit of having an improved denominator for MMR is important. Now, moving on to the other part, if we dig into death registration, I again am stating here that I think it would be important for EPMM to move to looking more closely at registration of maternal deaths and not all deaths, and that this focus can still be placed within the broader effort to strengthen CRVS systems. Death registration is important for legal rights, and it's also critical for planning purposes and monitoring progress. So capturing information on number and cause of maternal deaths basically allows program managers to understand where there needs to be greater allocation of resources, and where there may be problems that need to be further followed up. And then I also think that if we include tracking perinatal deaths, it can also improve maternal health through maybe more research on pathologies that happen during pregnancy, and interventions to prevent stillbirths can also improve maternal health. In terms of the state of measurement with death registration, a lot of the same limitations that I mentioned on birth registration are also applicable to death registration. And the alternatives to CRVS are surveys, census, and the RAMOS surveys. I am suggesting that rather than just looking at death registration, that we align more closely with the Maternal Death Surveillance and Response, MDSR or MPDSR. And this would be in keeping with the MDSR references in the EPMM theme document. It was recommended in phase 2 to do the maternal death review. And there's also this MDSR comes up in EPMM theme 11, construct 11.3, which I'll present to you and you will hear about in another presentation. So I would just advise that we, that perhaps the next step is to move from this more crude measure of birth and death registration to something more in line with these 4 MDSR indicators, which include a national policy to notify all maternal deaths, national policy to review all maternal deaths. The Maternal Death Review Committee meets at least biannually, and subnational maternal death review committees are also in existence at the district and facility levels. So here's what I told you. I just wanted to flag here that 5.2 and 11.3, the ones that are circled in red, I think we could align them better. And perhaps 5.2 could be those 4 indicators, and this one on completeness and quality is more, could be a different set of indicators that are more on the quality of that information for those other 4 indicators. So in terms of measurement of MDSR or MPDSR, I think there's a report that was published by WHO in 2016 that clearly defines a set of indicators that should be monitored, and there are potential data sources that exist. There's an MPDSR implementation toolkit under development. In terms of feasibility and data availability, data quality is a challenge, and that I think you will hear more about with 11.3 later on. But I think once there are mechanisms in place to get the information on these 4 indicators, then it should not be a challenge. There are already some mechanisms in place. My concern about them is, like the WHO policy survey, is to make sure that it's sufficiently funded to happen at a regular basis. So in terms of harmonization, I think that this is all just sort of an evolution where the MDSR has already been very deeply integrated into the EPMM phase 2 thematic documents, and just embracing more of these indicators that are in the MDSR framework just helps us to stay more aligned with that effort. And that's what I think. In terms of relevance, it would allow us to have critical information for global comparisons and for national use. And as I've already mentioned, there are available data sources, and there is a commitment for regular reporting on the set of indicators from UN agencies and partners. And I do think that if we have information on these indicators for all countries, we would have a very good grasp on how well countries are doing in implementing MPDSR and where more progress is needed. And I think that, again, the MDSR has that nice monitoring, review, and action cycle. And I think all of that is essential for proper planning, programming, and for ultimately improving maternal health. Thank you.